of the Public eHealth Innovation and Equity Project, Public eHealth in the Caribbean 3-part webinar series. Welcome, and we're so happy to have you. This morning we'll be focusing on Public eHealth in Action. My name is Soroya Julian, and I am the Young Professional for the Caribbean region for the ESAC project. All the presentations will be in English and they are being recorded. After both presentations, we will open the floor to some questions, and we will encourage you to post your questions in the comment section, in the chat section, after the presentations have been completed later on. At this time, I'd like to introduce you to Dr. Andrea Cortinoa, the co-director of the ESAC project, to bring some greetings.
Thank you, Soroya. It is a pleasure to be here with all of you, and I can see several old friends in the list of participants, so it's a real pleasure. I'm truly looking forward to learning by the experience of our distinguished guests today, and also from the questions that the other participants will have. Thank you, and I hope you all enjoy the opportunity.
Thank you, Andrea. I would just like to highlight the fact at this point that ESAC is a joint initiative between the Pan American Health Organization, PAHO, the University of Toronto, and funded by the IDRC. So in the room already, we would like to just recognize a couple representatives of the Pan American Health Organization. Andrea just spoke on behalf of the University of Toronto, and we are joined by Chaitali Singer from the IDRC. So thank you for coming. At this time, we want to just open up the floor a little bit to a poll question, looking at just kind of, introducing ourselves to each other, finding out where we are all from. So the poll question gives you options A to E, and if you look below the participants listing on the left column, you will see a smiley face, a little person, a hand, and the last little box, if you hover over it, it gives you the options A, B, C, or D. So you're able to click A, B, C, or D. Which region are you from? A, the Caribbean, B, Central America, including Mexico, C, South America, D, North America, and E, other. Great, I'm seeing the numbers coming in. Just allowing a little bit more time. If anybody has any questions, you can put it in the chat in terms of, difficulty with the poll. Just to repeat, the poll option is right below participants. It's the last box on the right. There's a box with the A letter beside the hand. If you hover over it, it gives you the responses. Okay. So I think that's it, and we're going to now share those responses very quickly. So good morning, welcome. Okay, so we can see that we have 20% from the Caribbean, 6% from Central America, 13% from South America, 26% from North America, and a few other 13%. Okay, so we're going to just move forward at this time. We're going to go ahead and go right into the presentation, and we're going to allow Sir Hassell to speak. But before that, I just want to introduce him properly. Sir Trevor Hassell is Adjunct Professor of Medicine, University of the West Indies, Barbados, and Honorary Consultant Physician and Cardiologist, Queen Elizabeth Hospital, Barbados. He is Chairman of the National Commission for Chronic Non-Communicable Diseases. He's also the President of the Healthy Caribbean Coalition, who he represents this morning. The Healthy Caribbean Coalition is a civil society network for combating chronic diseases. He is also chairman of the advisory committee of the Chronic Disease Research Center, University of the West Indies. Sir Hassell has held posts that include Vice President of the World Heart Federation, President of the Inter-American Heart Federation, and President, Caribbean Cardiac Society. Most recently, also Barbados Special Envoy for Chronic Diseases. Sir Hassell has played and continues to play a leading role locally, regionally, and internationally in efforts aimed at slowing the pandemic of chronic non-communicable diseases. Most recently, he was appointed to the Order of Barbados as a Knight of St. Andrew in recognition for outstanding contribution in the medical profession. So we are very, very honored to have Sir Hassell here with us, sharing the experience of the Healthy Caribbean Coalition in public e-health in action. Thank you.
So good morning, everyone. I'm Trevor Hassell, and thank you very much, Soraya, for that very generous introduction. The presentation that I'll make over the next 10 minutes or so has been produced by myself and Maisha Hutton, who is manager of the Healthy Caribbean Coalition. And as it's titled, Public e-Health in Action, Novel Caribbean Campaigns for NCD Awareness Using Mobile Phones in Advocacy and Education. And the purpose of this presentation is to share with you our experience. Essentially, what I shall do is to give a brief introduction of the Healthy Caribbean Coalition. I'll share with you some of our ICT campaigns, and I will perhaps project a bit on some of our future campaigns. And so the Healthy Caribbean Coalition arose, if one will, as an outcome of the Heads of Government of CARICOM Summit on Chronic Disease. This was a seminal event that took place in Port of Spain, Trinidad, and really served to focus global attention on chronic diseases. The Healthy Caribbean Coalition is in fact an alliance of Caribbean NCD civil society organizations, and its single purpose is to address NCDs. For purposes of good governance and management, it is registered as a not-for-profit company. The strategic plan of the Healthy Caribbean Coalition was developed, that is the most recent strategic plan, was developed at a meeting in Jamaica in May of 2012. That meeting was titled a rallying around chronic diseases. 4 strategic priority areas were identified: advocacy, enhancing communication, capacity building, and the promotion of mHealth and eHealth. So as you can see, the issue of mHealth and eHealth was identified as a major priority area. Let us now speak of some of the novel projects. The first project that I'd like to highlight is the ICT project that was titled Get the Message. It was very significantly branded in the way that I've demonstrated on this slide. The purpose of the Get the Message campaign was essentially to empower people to agitate for change that leads to a decline in common risk factors for NCDs. A further objective was to obtain regional support for Caribbean leaders attending the United Nations high-level meeting of 2011. And the further objective was to familiarize the public with the topic of chronic diseases. From the very outset, we had some very interesting challenges. First of all, as is so often in these situations, there was limited funding. But perhaps an even more fascinating challenge was the fact that this campaign encompassed or involved 17 Caribbean territories with different cultures, different languages, and varying levels of literacy. A further unique challenge was the introduction of the concept of using mobile phones for advocacy, and also the sharing of the importance of the United Nations Summit to the region. So, given that finances were limited, what we did was we established a significant partnership with the Pan America PAHO, with local health NGOs, with 2 regional mobile phone carriers, with the regional media networks, the traditional media of radio, TV, and the newspapers, and also with a large regional health insurance company. The process was essentially a very simple one, in that text codes for each country were created by mobile phone carriers, and 160-character text blasts were sent to mobile phone customers by the carriers. The individual SMX or text the word yes to the short code. That was the advocacy call. And the response was an automatic thank you response sent to mobile phone subscribers. So the text blast then simply said text yes to a particular short code to support Caribbean leaders at the UN Summit on Chronic Diseases and join the healthy revolution. And just to repeat for emphasis, those receiving the text blast text yes, and in turn the response to them was thank you for the response. The call to action was really the simplest statement of advocacy. I emphasize this. So it was just simply yes. And we used various approaches. Some of them we have demonstrated here. We used posters in the bottom left-hand corner. Rihanna Loud Tour took place in Barbados and was attended by some 30,000 persons. And at the big screen in the background of this picture, we promoted the Get the Message campaign. The outcome was that we achieved some more than 700,000 responses or indications of support using both mobile phones as well as the electronic media. And this program was presented at the United Nations high-level meeting as a side effect. What were some of the lessons learned? Well, firstly, there was a need to define clearly the role of regional partners. Campaigns of this kind. Another issue that we learned, a lesson we learned, that there was a certain expertise in creating text blast messages and a delivery schedule. Lesson learned that was important was the need to get buy-in from local NGOs and volunteers. A critical success factor, which we've emphasized, was the need for both the the SMS text messages to be free of cost, both in the delivery and in the receipt. Another important lesson learned was that SMS text data collection and reporting is an important aspect of this type of initiative. And finally, we came to realize very quickly that social media provides a very cost-effective communication channel to mobilize a campaign quickly. So that was the Get the Message campaign. In summary, the use of mobile phones, the electronic media, and the traditional media to advocate for the United Nations high-level meeting. And it was an entirely successful campaign, garnering more than 700,000 messages of support. Another initiative that we've used is the mobilizing of heart foundations in support of World Heart Day. We did this in 2012, and in that campaign, what we did was I detailed, in fact, what we did, and I'm not sure in the interest of time that we can go through all of this, but so for example, we sent out nearly 1 million World Heart Day blasts sent out by one of the service providers, mobile phone service providers, and these went out to several Caribbean countries such as Anguilla and Montserrat and Turks and Caicos. And we also sent World Heart Day blasts to some 30,000 mobile phone service providers here in Barbados. And you can get an idea of the kind of message we sent. Say no to tobacco, eat more fruit and veggies, and exercise regularly. And the call was also to visit the Healthy Caribbean Coalition for activities and a free heart guide that we produced. There was also an electronic component to the World Heart Day program, as I've outlined on this slide, in which we engage the website, our Healthy Caribbean Coalition website, and also our Facebook. I encourage you to visit the Healthy Caribbean Coalition website, www.healthycaribbean.org, for some of this information that I'm sharing with you. And of course, our Get the Message Facebook page also has a significant amount of information. A third ICT project that we engaged in, and this was last year, was that we piloted a project titled Caribbean Smoke-Free Text. We piloted this in Barbados, and it was a pilot of the U.S. Department of Health and Human Services and the National Cancer Institute Smoke-Free Text campaign. So this project was an intensive mobile phone project that supported smokers to cease smoking within 14 days or less using supportive text messages over a period of approximately 8 weeks. And we really had two objectives. Firstly, to determine if the program could technically be replicated in the Caribbean, and secondly, we sought to determine how effective the program was at supporting smoking cessation. There was lots of information that we obtained. This slide just simply shares with you the outcome as it relates to the quitting of smoking. And what you can see here is that if you look at the first two rows, 10 of the 41 persons had quit on the date and have been smoke-free since, or had a few slips since they had quit. The final project is a very comprehensive one, and I'm afraid I won't be able to do justice to this in its entirety. But what really the program is a Caribbean Civil Society cervical cancer program that has several components. But primarily, the purpose of this program is to build advocacy capacity around cervical cancer prevention and treatment among Caribbean regional cancer NGOs. The components of the program include the production of a civil society advocacy handbook. In addition, the establishment of a Caribbean cancer NGO network, but perhaps, and other aspects, but perhaps most important to this presentation, the initiation of an electronic petition signature campaign. This is the first campaign of its type that's been conducted in the Caribbean, and it's in the first phase, it sought to and seeks to, because it's still in existence, it seeks to enlist the support of persons in the Caribbean using the electronic media, seeking to obtain and petition and asking leaders of the Caribbean to do more, even more than they are doing at the moment around cervical cancer. At the moment, the petition, we have received support from some 9,000 persons. The electronic petition is now at the stage where we are now seeking to extend it to the use of mobile phones, and we look forward perhaps to discussing that aspect later in this session. This gives some indication of the of one of our electronic pages, if you will, and the reason we are showing this in particular is that you will see in the top left-hand column a stamp that says "End Cervical Cancer Now." And what this does, this serves to remind me that if one if one simply Googled "End Cervical Cancer Now," and one could then support the electronic petition that way, the e-petition. And so what of the future? The future then calls for the scaling up of the smoke-free text campaign to national and multi-country level. So even as we speak to you today, we are looking to take this initiative to 3 countries in the Caribbean. We're also at this point making plans to use mobile phones at the national level to educate and inform the public about NCD prevention, treatment, and control. And as I've mentioned previously, we will also be using mobile phones to expand the e-petition around cervical cancer. And so, in conclusion, I want to share with the audience the fact that, in my judgment and that of the co-presenter, tremendous scope exists in the Caribbean for further development of application of ICT to all aspects of the response to NCDs. What we have done is to provide an insight into this perspective by sharing with you 4 examples of the application of ICT. In our judgment, funding agencies and other organizations now have an opportunity to partner with the HCC in the promotion and application of mHealth and eHealth in the Caribbean. Thank you very much, and I hope that the presentation was heard well by everyone, and I apologize for going a bit over the planned time. Thank you.